This is Dr. Stewart from Timonian Foot and Ankle Center, and we're going to talk about ankle sprains. Ankle sprains are an extremely common injury. They're actually one of the most common reasons people go to an emergency room or an urgent care facility. And ankle sprains are a stretching of the ligament. So I'm going to show you here a foot model that we have, a foot and ankle model. And if you can look, this is an example of a ligament. A ligament attaches from bone to bone. This is our fibula bone on our ankle, and actually this is the talus bone on the foot, and this ligament spans to the side of the ankle, and this ligament is responsible for restricting our ankle from turning over, from rolling. So ankle injuries, there are ligaments on all around the ankle. There are ligaments on this side of the ankle, which is the lateral ankle. There are ligaments on the medial side of the ankle, which is on this side of the ankle here. But we're going to focus mainly on lateral ankle injuries because that's more commonly where they occur. And most people are very familiar with these injuries because they're a common injury, and they can be minor or they can be severe. And ankle sprains essentially are when the ligament is stretched, okay? And the degree of injury really depends on how much this ligament is stretched, and in fact, how many times you may have suffered from the injury. So, if you have suffered repetitive ankle sprains, your outcome may be a little bit less favorable as opposed to doing it one time. But what generally happens with these injuries, they're generally something that people notice. Occasionally you'll get someone that comes in and they didn't really realize they turned their ankle, didn't give it much attention, and then a few days later it starts hurting. But more often than not, it happens while people are walking and they take a misstep. They may step on a rock or step off of a curb, or they may be hiking and the same event happens, playing tennis. They roll their ankle during exercise. These are generally acute events, and they can be very painful. And most of the time, in a more moderate ankle sprain, patients fairly quickly develop a lot of swelling, bruising. They can't walk. They can't fully weight bear on their foot. So when they have these injuries, patients will come into the office, and sometimes it's really hard for us to initially assess the injury based on the fact that the patient they're having a lot of pain. I think that it's important to note that we have to really get the swelling down to determine what the extent of the injury is. We'll always take some plain film x-rays. We generally do not order more advanced imaging studies like an MRI because initially it's not going to change the treatment. Most of these ankle sprains get better without surgical care. Some ankle sprains will go on to do surgical care. I happen to do a lot of ankle sprain repair in my office, but I will say that I see more ankle sprains that get better non-surgically than ultimately need surgery. But the key to getting these injuries better are the simple standards of rest, ice, elevation, and we want to immobilize the patients. We want to get them their pain under control. We can do this with anti-inflammatory medications as needed. We try to avoid injecting steroids because if there's a ligament injury, steroids can actually really promote some further disruption of the soft tissues. We want to make sure that these soft tissues heal appropriately. And there's a fine balancing act with these injuries of how long to keep someone off their foot versus getting range of motion back. Because important to note that if you immobilize for too long, the joint can really get stiff. So you're trying to allow these soft tissue structures just to not move so that they can scar down. And generally that's what happens. So, if there's a little tear, patients from an ankle sprain, if it's a minor sprain, they can take 3 to 6 weeks to get better. If it's a more significant sprain, it could take 2, 3, 4, 5 months to get better. If it's a complete rupture of the ligament, it can take 6 months to a year to get better, and sometimes these don't get better. People can have chronic sprains from their foot type. Some patients have what's called a cavus foot type, which means their foot is very high arched and they just roll their foot. But we always treat these conservatively, first and foremost. It's extremely rare to take this to the operating room unless the foot is literally dangling. The foot is completely loose and it's dangling and there's gross instability. Other than that, we would, or there's dislocation of the foot or ankle, we wouldn't really take this to the operating room immediately. Most patients, after they're immobilized and rest, they'll do some physical therapy. And more often than not, people go back to doing what they want to do. I find it's very important with these injuries to mobilize with a soft lace-up ankle brace for an extended period of time after the injury, just to reduce the risk of re-injury, because there's nothing worse than going through a long rehab and then injuring yourself again. There are some cases, though, that we do need to do surgery. As I stated earlier, I do a fair amount of these surgeries, and what we typically do, again, more of the injuries are on the outside of the ankle. We'll repair the ligament. Most of the time, we're able to use the patient's native ligament. We'll use a fancy system where we have some bone anchors and we can tighten this up. And in certain cases where the injury is more severe, we'll have to drill some holes in these bones and put a tendon graft. But at the end of the day, ankle sprains are a common injury, and you generally know it when it happens. And we like to see people for these injuries pretty quickly so we can get them treated. So if you've injured or sprained your ankle and you need some help, feel free to submit a request on this page below, or give the office a call and we'll be happy to see you and treat your ankle sprain.